Welcome to another episode of Answers for Families. I'm your host, Dr. Tommy Martin, a combined internal medicine and pediatric physician and a pediatrician at Boston Children's Hospital in the Pediatric Intermediate Care Unit. And today I am super excited for our panelist, Dr. Ed Smith, who's a neurosurgeon. Today we're going to be talking about online virtual visits and second opinion, which I think is super important. Dr. Smith, thank you so much for coming.
It's my pleasure. I'm really excited to be here, and I agree with you. This is something I think is a real great service that Boston Children's offers.
Yes, I agree. And especially in the digital world, this is just going to be becoming more and more common. What is a virtual appointment?
Yeah, so a virtual appointment is something where you use a computer to talk to the physicians or the teams that is involved in your child's care. They're just like real live appointments, and they can be offered in different languages, for example, if people need that. There are interpreters. You can get them, for example, with secure video links. We can get them through the portal online, and they're really very helpful because these are things that allow you to sort of do this from the comfort of your own home. It allows you to involve other family members, you can get other providers involved, and it really allows you to essentially get Children's Hospital right into your very home through the computer.
That's incredible. And I know that you mentioned the computer, and I'm completely unaware, but is it possible to do these visits through your cell phone as well, or does it have to be like a laptop or a desktop computer?
Anything that can get on the internet can get you there.
Wow.
And so, I personally have had my kids help me with that because it's a lot easier for them. But honestly, it is really, really easy, and any device that allows you to connect to the internet can really help you do a virtual visit.
That's incredible. So Boston Children's Hospital in the palm of your hand.
Yes.
Incredible. And so, can this be done with multiple different types of visits, or does it have to be a specific type of visit, or does it go across specialties?
Yeah, so one of the great things is virtual visits are available for pretty much any specialty, and while there are some kinds of visits that need to be done in person, if there's something physical that needs to be looked at, pretty much everything can be done virtually. So for example, you can do post-operative visits, you can do routine checkups like things for labs, you can have a well visit. Really across the entire board, any sort of visit can be done virtually that you can be done physically, again with some very, very rare exceptions. So it's a real great tool that we have in our toolbox to make the care of our children and our families a lot easier.
Yeah, that is so beneficial. And I have two kiddos myself, and I live a ways away from Boston. So virtual visits, I could see for me would have a lot of benefits. But what would you say are some of the other benefits of being able to have these virtual appointments?
Well, one of the biggest ones is not fighting Boston traffic. So while there are a lot of sort of Boston satellites around, no matter where you go, even if it's not to downtown Boston, there's going to be the challenge of getting out of your house. You may miss some school for the kids. It may involve taking time off of work, paying for parking. All those things don't have to happen with a virtual visit. So it really makes things a lot shorter, a lot easier. If the weather's bad, occasionally the weather's not great here in New England, and one of the advantages is you can do that. Another big advantage is you can do it anywhere you are in the world. So sometimes people travel. Many of our patients come from far places beyond New England, and all those things can be done virtually in a way that we really couldn't do before, and adds a lot of convenience, safety, time to making your day better to take care of your kids.
Wow, that is just a huge added benefit that I believe that a lot of our patients will utilize. Something a lot of patients like to bring family members with them. Is that something that you could still do on a virtual visit?
Yeah, so the internet apparently is very handy.
Yeah.
People use it all the time, and with that, links can be used by pretty much anyone that would be important to the visit. So sometimes people like to have other family members involved. Sometimes they want a listener, where it's hard to keep track of everything that's going on, and you can have a friend or family member help take care of that. Sometimes other healthcare providers that are nearby, like a pediatrician or a different specialty, can also be on at the same time, and all those things tend to make the visits easier. They tend to coordinate care, so one hand knows what the other hand is doing, and ultimately, like I said, it really is a great way to get people engaged with the care that's needed, and it's as easy as turning on your computer or your cell phone.
Wow. We could see that there are so many benefits, and we talked about the multitude of different types of appointments that you could have through these virtual visits. But what if, we have people that listen and that come from Boston Children's all over the world. What if someone lives in another state and wants to seek out Boston Children's since they know that we have these virtual visits? Is that a possibility, or how would they navigate that?
Yeah, so this happens to us quite a bit, both myself in neurosurgery and many other specialties. And really, there's the opportunity to get for example, second opinions. And this is something where people can find out, is their care something that is, agreed upon in other places. It gives you the opportunity, especially in complex cases, doesn't mean that anything's gone wrong, but it allows you to sort of get the thoughts in something that can be very complicated and see what other people think about it. In addition, I think that, it can help to clarify things like a diagnosis. It can help figure out what a treatment plan might be. These are all the kind of things people can do from all around the world, not just outside of New England, but really anywhere on the planet. And it's something that we do routinely for people essentially all the time and all the places we can find.
Yeah, I think second opinions is something that is very, very important, and we're going to dive deep into that. And just really quickly, I know that a lot of people are wondering for for virtual visits, where can they get information about this? And so, if any of our patients currently or anybody's interested in looking for virtual appointments, all you have to do is go to childrenshospital.org/virtual visits, and you'll be able to find some information there where you can check it out to see if it's right for your family. And moving on to second opinions, this is something that I am very, very passionate about. And I think that coming from, like my son has complex needs, and second opinions are something that we sought after. And I think that so many families maybe feel guilty or they feel shame about going against their doctor. Can you provide some insight and maybe just some reassurance that it's completely okay to look for second opinions if
Yeah, I mean, for Pete's sake, if you're looking for a car, you'd probably go to a couple of dealerships, right?
Right, yeah.
And this is your kid, and you want to make sure that they're getting the best care possible. Many of the people that we see and treat here at Children's can have very complicated medical conditions. And at the very least, it may provide reassurance that, hey, your local team is doing the right thing. And on the other hand, it may provide some new insight that could provide grounds for discussion. It is absolutely the right thing to do. It's your child. And I think, people should feel comfortable about doing that. And there are lots of different ways that people can get other opinions. And, I think Children's offers several different ways to help get the answers that we all want to give to taking care of the kids we are privileged to, see in our practice.
Yeah, and at the end of the day, I think us as physicians and physicians in other states or other places that may be their primary doctor, all of us have the same goal, and that is to do what is best for the child. Yeah. And at the end of the day, if that's getting more insight from more expert physicians, like what better way to make sure we're truly providing the best evidence-based care for our patients than making sure all the experts agree. And so I think that's a great way to go about it.
Yeah, and I would comment, especially in something like neurosurgery or a lot of other fields, even if the opinion is exactly the same and you agree on the same treatment plan, sometimes it can really just clarify what is going on or what is planned by having a different perspective and a different voice of the same plan. So, it is really important to understand that getting second opinions, working on these types of team-based approaches are things that are good things, and I think most doctors would encourage their patients to get second opinions. Yeah. I certainly do for many of my kids.
Yeah, and I feel the exact same way. So all the parents out there, if you are considering a second opinion, just know that you do not have to worry about upsetting your current doctor. Like, we are all in this to provide your child with the best care. And if you believe you need a second opinion, I would say 100% go for it, get the second opinion, and get as much information as you can. And at Boston Children's, we offer second opinions. And in what different ways do those come? Do those have to be in person? Are they online?
Right. So, really, there are several different ways you can get a second opinion. One of the most common ones is a sort of written online second opinion. So you don't necessarily have to come in for a visit or do a virtual visit. There you can submit your questions and your case, and you can get an online second opinion. These are usually best for new patients, where you say, gee, I haven't had a connection with Children's before. I'm wondering about this unusual diagnosis, or I'm not sure what to do. And that online second opinion really, I think, can provide some insight and some guidance where it's all written down. It makes it clear. You can refer back to it. It's very, very helpful. On the other hand, sometimes people have established care and they say, gee, I really, I know that this idea has been suggested. Can we get an actual visit and have a virtual visit with our provider or another provider to try to clarify things or to make things a little clearer or to just hear what somebody else's thoughts are on something? So those are all options in addition to the traditional in-person visit that are available, the written online one, the virtual visit. Basically, we try to tailor what is best for the family and easiest for them to get the answers that the families need.
Okay. That's incredible. And then, I think there's some thought that second opinions are only for big surgeries or maybe high-risk surgeries. Is that true, or are second opinions only for surgical cases, or can anyone get one based upon what their child needs?
Anyone can get them for anything they need, right? I mean, medicine's a complicated thing, and there's a heck of a lot more to it than surgery, although as a surgeon, that's probably, where my mind goes the most. But people, one of the hardest things sometimes can be getting a diagnosis. What the heck's going on? And we have some very smart people at Children's that can help with making the diagnosis, and that's the starting thing for any sort of treatment. A second thing is treatment plans. We may know what's going on, but not just with surgery, but there's lots of ways to treat lots of different conditions. And so getting some thoughts about, well, what is the best treatment plan? How is that treatment plan administered? How can that treatment plan be tailored to my child and their unique problems? And these are all things that sort of virtual visits, using these resources for second opinions can help to do. And of course, one of the ones that's near and dear to my heart is the question about surgeries. And of course, that's the easy one, but really these kind of opinions are available for any aspect of medicine, from the very start with a diagnosis to, after treatment, how is my child recovering and what are the best ways to maximize them getting back to living their lives.
Yeah, that is so helpful. And, how common would you say second opinions are? And then you already touched on this a little bit, but how can they be beneficial for the families?
Yeah, I mean, so first of all, they're incredibly common, and I think they're becoming more so as people are becoming aware of the fact that these services are available and they're utilizing them, and I think they should. In fact, most of the people that I see in my practice at Children's many times are coming for second opinions or have already seen other doctors, and I would say that this is something that is more and more becoming sort of standard of care and a common practice to do. In terms of what the practices of doing that, people come from all over, and they're not shy about saying, well, gee, doc, can you clarify this? Can you help me understand this better? And it really is something that I think it can help to make something that is unclear a lot clearer for them, and we use them all the time. So, I think you should, and it's important to really understand what's going on with your kid.
Yeah, and with it being so common for, some of our viewers, if they believe that their child needs a second opinion and would like to pursue Boston Children's, how would they kind of go about the process of making sure they can get that second opinion?
Yeah, so first of all, there's nothing wrong with getting a second opinion, and, if you want, as I mentioned, sort of the two big ways you do this. One is the online second opinion, and no referral is needed for that. You don't need to get your pediatrician or your primary care doctor or whatever specialist you're seeing to say, hey, I need to write you a prescription for a referral. You can just get online and contact Boston Children's, and you can do an online second opinion anytime with no referral. There's nothing wrong with it. You're just looking for information. On the other hand, you can also have very formal sort of referrals. And if your primary care doctor or your specialist says, boy, I'm kind of flummoxed, or I think you should get a second opinion, you can also specifically ask for a doctor or service, and you can arrange a virtual visit or something, directly focused on what it is you'd like. So there are many different options, and like I said, these are things we can tailor to what's best needed for the child.
Yeah, that's again so helpful. And I know you mentioned this before, but this is not just in the United States, correct? People that may be in other countries may be able to get a second opinion here as well.
Yeah, I mean, again, anywhere the internet works is where you can get a second opinion. And we've had some really interesting places where people have come in. But, this is, again, I think so incredibly helpful, because while we're very lucky to be here in Boston, where we have, Boston Children's Hospital right here and these resources, there are a lot of people that are in remote places that may not have access to the same amount of health care, or they may have very different systems. So, I've done virtual visits and second opinions in the middle of the night because of the time zone differences. I probably apologize ahead of time for how I look sometimes on those, but really it is a resource that can happen anytime, anywhere, all you need is an internet connection.
Yeah, that's such an incredible resource. And Dr. Smith, we had some of our viewers submit some questions, and so I'm going to ask you a couple questions that were submitted. And so one would just be, we've talked about both of these things, but could you clarify in maybe like a distinct term, what is the difference in a second opinion versus an online second opinion?
Yeah, so an online second opinion is something where it is written, so it's not talking to somebody and going back and forth. You're able to sort of have it in a sheet of paper. Many times the records and the relevant, for example, if images are done like x-rays or MRIs, those are often put in a computer system. The physician will review them and they'll submit a written opinion to them. You don't need any referral for that. That can be anybody, anytime. In contrast, a virtual visit is something where you're talking to somebody and you're on the screen with them, you're having that discussion, and that can be usually something where you have a little bit better sense of exactly what you're looking for and what you're asking, and that can be, you know, a conversation with the physician or physicians. And the last thing I would comment is many of these can be done with a multidisciplinary group. So one of the nice things about children's is you don't necessarily have to have just one doctor. And as an example, in our neurosurgery group, we take care of some very complicated conditions, and sometimes you might need a neurosurgeon, a neurologist, a geneticist, and there's this opportunity with virtual visits where you can get everybody all online at the same time. And quite frankly, these are things where even physicians, if they're traveling or if they're at a conference, many times I've been able to do these virtual visits and, you know, make them at a time that's convenient for the families, where you can get multiple specialists and sort of one-stop shopping. So there's a lot of different ways that basically an online second opinion, this written result, is super helpful. And then the virtual visits offers a different type of flexibility that really can bring together, you know, that conversation and that back and forth as well. So different things, different tools, all tailored to help your kid.
Yeah, I think it's so incredible. Media is, I believe, truly making it to where patients can get better access to us, even if they're having a really, really hard time to, and get as much help as they need for their kiddos, which I think is so beneficial. So we've talked a lot about virtual visits and online second opinions. If you had to give, one piece of advice or one thing to say about either virtual visits, online second opinions, or both, what would you tell the viewers?
Number one, they're great. I mean, anything that increases access and democratizes medicine so that your kid gets the care you need, it's fantastic. And number two, speaking as an old guy, it's not that scary. They're easy to do. If you're watching this, you probably know how to use the internet. This is not a challenging thing. And honestly, it's easy, it's incredibly helpful, and you have the entire hospital, all the resources, some of the smartest folks in the world, really just here to help your kid, and it's just a push of a button away.
I agree with everything that Dr. Smith has said, and I would just add, please never feel guilty for asking for a second opinion. We all know that you want to do what is absolute best for your child, and no physician should ever feel like you do not trust them or that you do not believe in them. We know that second opinions can be so valuable, and we would strongly encourage it. So if you even have just a little bit of hesitation or a little inkling about wondering about a second opinion, I would say go for it, and all of your physicians would be right there behind you, supporting you, making sure you get the best care for your child. Dr. Smith, I want to thank you so much for coming on the webinar today and teaching us all about virtual visits and online second opinions. I definitely think these are utilities, these are mechanisms in place to help our patients truly get the best care that they need, and thank you again for that.
My pleasure, and this is a great service, and it was great chatting with you. If people have questions or comments, reach out. We're here. Our job is to help, and this is another way to make that help reach farther and do better.
Of course, and for all of our viewers, thank you so much for tuning in, for sending in your questions, and for just supporting the webinar. If you guys would like to stay closer connected, make sure to check out all of our social media channels, and then also the Answers for Families webinar series on YouTube. There's a playlist there. You can check through all of the episodes that we've had over the past couple years. Make sure to stay tuned for next month's episode.